Thank you so much for a very nice presentation and very practical presentation. And for the next speaker, I would like to invite Dr. Alberto Ferguson Bermudez from Colombia. He is psychiatrist, psychoanalyst from University del Rosario. And it is a very interesting topic about how COVID brought both pain and relief for people diagnosed with severe mental illness. Dr. Alberto, the stage is yours. You're welcome.
Thank you very much, Ramune, and thanks for everybody. I'm so happy to be here. This is such an important meeting for many of us. We expect this meeting to happen. It's not been easy with COVID precisely. It wasn't possible last year. I'm very happy that we made it this time in a different way, but the basics are there, and that's the fact that we are together for us in our program. And not only for me, I'm the only one who has attended these meetings in my program, in my group in Colombia. But I share all that we say here with all the group, and it's a big moment of relief. It's a moment where we feel welcomed. We feel a really open atmosphere to discuss innovative ideas. I feel very comfortable with what we call the non-structure of these meetings. I've learned to feel very comfortable with uncertainty. Even at a certain point, I was concerned that we were having a bit too much of a structure and too much certainty. So this is something I've learned with during the past years. I don't remember exactly, but I think I have attended the last 5 or 6 meetings of this group. I'm going to just, I do have a presentation which I will show in a moment. The presentation is going to be in and off because with Zoom, we are all learning details from Zoom. And once, I don't know if you realize, but once you put a presentation, you stop, you see more the presentation than the people. Even if it's just names, it doesn't matter if it's the cameras are in or out. You feel much more connected with a group without the presentation in Zoom. So I'll put it in and out just to help me. So I'm going to give you a brief idea about Colombia. I guess all of you have heard at least of Colombia. Most of you have not been in Colombia. I know a few of you have been in Colombia. Anders, of course, has been our guest here, our very special guest. And Colombia, as you know, is a country situated at the north of South America. And there are lots of things because of which Colombia is kind of known worldwide. First, because of drug trafficking, which was not a very nice thing to be known about. But then also the peace process, which happened in Colombia. My group and I was personally very actively involved in the process of the peace process and the dialogues with the leftist armed groups, which led to the peace, at least to a partial peace. And I say this because our program is kind of has a lot to do with this process, as I will tell you gradually as I speak. The idea that I would like to transmit about Colombia is that all this that you hear about Colombia are things which are definitely true. Drug trafficking has been here for many years. The peace process was there. There are lots of armed conflict here, quite a few of violence. But that's all of that is true, but it's certainly not the whole truth. I would say it's not a big percentage of the truth. Colombia is certainly much more than that. It's a thriving economy. It's a thriving country in many ways, in research and scientific development, in you name it, and it's So it's a very fascinating mix. I'm presently working with the Truth Commission, which was kind of begun after the peace process with the FARC was signed. And that's been an incredible experience. And I'll show you how our program is kind of also connected to all these experiences of peace in Colombia. But in this case, I'm going to share my screen to show you I'll walk you through the presentation very quickly, just so that you see what I'm going to talk about, and then I'll come back and probably talk without the presentation. Let me see if this works. Here, it should. Are you seeing my screen now? Can someone tell me?
Yes, dear Alberto, we are seeing now the slideshow is starting.
Thank you very much. Thank you. So, yeah, I'm going to talk today about the pain and relief that came with COVID in our experience. Just let me tell you, all that I'm going to say today is based on our experience, and you are the ones to decide what pieces of it can be useful to understand what's been going on in other places. So we're going to talk about how the pandemic brought relief and pain, and we are going to do a lot of emphasis in the changing lifestyle. This is not new for us in our approach, in our work, in our program. We've always valued a lot the importance of lifestyle in many ways, but including as a tool of recovery. We think that people, once we did a very detailed research, and we saw very clearly that people who had been able to recover in a successful way were people who had decided by themselves to somehow redesign their lifestyles according to themselves, according to their own environment, to their own communities, and that they were able to become the leaders of that process, and to kind of get detached and not accept others to lead their process, but they decided to do it by themselves with the support of the community. And so lifestyle has been very important piece of our tools to recovery. And also what we've seen is that when people are for some reason not leading a lifestyle that fits their own personality and their own way of being and what allows them to be, you see, lifestyle is one of the most important things that allow you to be or not to be, in a way, to use the famous phrase, right? You can only be yourself in certain lifestyles, and it's very difficult to be in other lifestyles. So at least that's what we've seen. So this became very important. And one of the things that the pandemic brought from the beginning was that a sudden change of lifestyle. That's true in Colombia, in Lithuania, you name it. Some external factors suddenly changed the lifestyle of most of us, the world, and that was the beginning of. I think I have to connect my computer. It's going out of battery. I have the cable here. Okay, that's it. We're safe now. And so this was a sudden change, and we all remember. I know, beginning of the 2020, when we suddenly, lockdowns were the first, but that was not the only change in lifestyle, so it was very sudden, so we're going to talk about how that happened to all of us, brought lots of pain, but somehow it also brought some relief to some people. So this change in lifestyle, basically with the lockdowns, which brought with it many new family dynamics, right? We began to let's take some examples. All of us, people who lived by themselves, for example. Okay, they had discovered a way to live by themselves, but they have some routines to go out to see people in other places. So they lived by themselves for certain hours a day, but suddenly, at least for some periods of time, they had to be 24 hours a day by themselves. And also in families, couples, families that live together, they got certain amount of hours that where they had to live together, but suddenly they had to, that was not a choice, to spend the whole day together. And very soon we all began to see lots of strange consequences of this sudden change in the dynamics, spending the whole 24 hours a day with your partner, for example, or having to be alone the whole day or the whole week or the whole month. That's different. And people with small kids, all with the parents, all this that we know brought lots of changes. And the lockdowns also began to bring with them lots of changes in the type of relationship. We knowingly or unknowingly, we somehow design the way we relate to people, the intensity, the amount of time we spend with them, the places we go. And all this suddenly changed. People who were couples but didn't live in the same place, for example, you also saw those sort of changes, and they saw each other certain days a week, but that became a problem because they were now they were not the same household somehow. So they shouldn't be together, at least, or they should quarantine to do that. All those dynamics that worldwide we had to change. What many things to say about the work, the way we work, the way we use our leisure time, all these things. And as I mentioned, the idea we have is that the lifestyle is linked very deeply to the possibility of being yourself, and it's something you craft gradually, slowly, very carefully throughout your life. If you suddenly see why you do this, and I'm talking about the small details of lifestyle, not only the big picture, but the small routines, the way you handle your day. It's full of yourself. It's full of ways to handle your anxieties, to handle your illusions, to see how to deal with your inner world, your outer world. And it's a very important piece of how you are. The important thing of this, as I'll say in a minute, in our program, in our approach that we have called accompanied self-rehabilitation, we are now not very happy about the word rehabilitation. It's kind of an old style word, but we still use it because that's how we began to talk 20 or 30 years ago. So, but we still do use the word. But what we mean by that is the importance that the person who suffers, the person who has the difficulty, whatever it is, becomes the leader of his own process, and that we so-called experts really changed this idea of expertise to being able to accompany people in the best possible way. That's what we've been doing for the past years. And in doing that, one of the main things that we saw in the program from the beginning is how powerful it is, in the good or in the bad sense, how the small details of the lifestyle of a person. And so I guess that we somehow encouraged people to rethink that, as far as possible. Of course, there are lots of limitations. People cannot decide exactly what a lifestyle they can lead. There are financial restrictions, many restrictions, but even if you stay inside your restrictions, there are many possible choices that sometimes we don't realize that we can use. And we began to see this in our program, how people, there was a saying in the people in our program, that many times the only way not to go really mad is to look as if you were mad, and the only way not to become crazy is to look crazy sometimes, and to live in a way and do things that for others they are impossible to understand, and that people in society might think that you're strange, or even that you're let's use the word in a way that just allows us to understand what we're talking about. No, so to live in a way that looks crazy or looks like if you were sort of mad, but that's the only way to get rid of so-called symptoms, right? That's the only way sometimes people can sleep, can develop as human beings, can think, can feel, can relate to others. So this is something we welcomed a lot, this creativity and this possibility to really do your best in finding a lifestyle that suits you. And this is also, well, I'm going to talk about, this is a famous example of Andrew, but I imagine he'll talk about this in his presentation. Because as we've done other times, the presentation that comes after mine, which is by Andrews, is somehow connected, right? We, in the past meetings, we've kind of shared our presentations in a way that they are complementary. So we'll talk about that after that. The other piece that it's important for me to mention to you is what to do with the system. I mean the health system or the mental health system. We all struggle with that in all these experiences where we try to build a new idea or to present a different perspective. We all have difficulties with the system. So that's why I think this is a very important piece that I want to mention. And the system, there are two big ways that we are going to talk about the system. How to get rid of the system or get out of the system. I'll tell you our story as far as that is concerned. And the other challenge with the system is how can we change the system, which is also a very important thing. So let me talk about these two things. Getting out, in our case, and that's why I say that it's our story, we initially, let's say 30 years ago, we were considered, we were within the mental health system, and we were considered a level, I don't know, in Colombia, it was level 3 or 4 institution, which was supposed to be a privilege. And we began to change that and to change the approach completely when we began to share all the ideas that this group shares, all the values that this group shares. So I don't have to talk about those values because they're here in all the people that are present in this conference and in this group. So when we decided to change that, we tried to change it and remain within the system and make changes, but it was absolutely impossible. In our case, to do what we wanted to do, to really, at the beginning, it was probably just to really create a place where we can create a recovery atmosphere where people really recovered. When we began to learn about open dialogue, when we began to introduce dialogicity into our approach, and together with all the principles we were already working at what we called accompanied self-rehabilitation, we realized that it was practically impossible to do within our system, with our mental system, because of the protocols, because of all that we were demanded to be with. So we tried it. We did our best. I remember that we did an agreement with the municipality of Bogota, the capital of Colombia, close to where the program works, which is not actually there. It's in a small town called Sopó, which is near Bogota, where I'm actually at this exact moment. And so we did an agreement with the municipality to invite homeless people diagnosed with severe mental illness to our program. But it was a completely different approach from the psychiatric hospital. It was a completely open, and we were kind of using work and art, and I'm talking 30 or 40 years ago, right, as a rehabilitation tool. But this was impossible. They remember the they were supposed to pay, for what we were doing, which is one of the problems of getting out of the system, is that you're out of money, and so they were going to pay us. And I remember we began the agreement, and after 3 months, my colleague psychiatrists came from the municipality to see the program. They congratulated us and they said, "Oh, everybody's looking much better here in this environment, so it's time for them to leave." And then I told them, "Oh my God, we have a problem here. We in our perspective, this is a very long process. This is just beginning here, and you think it's finished." And so anyway, that ended. That was the last try we made to work with the system, and we kind of finished the agreement and decided to go by ourselves. And then we had to hire lawyers and people to get out of the system. And so we were able to present the idea that we had become just, we're no longer a level whatever institution in psychiatry, that we were just a shelter for homeless people, and don't worry about us. And so we managed to, and shelters for homeless were not part of the mental health system. So there we were able to begin our process and innovation and understand people differently and be open to new approaches and new ways to care for our program. The only way in our case was to get out of the system. Of course, as I mentioned in the slide, the other way that we've tried to work changing the system, and many of us do that, is working. I teach at a university in Colombia, the Rosario University. I've been for 40 years a professor of psychiatry over there, and that's the other place where I try to change, or that's the only place where I continue to try to change the system, is with new students, with new medical doctors, with new mental health professionals, you name it, and that's the way to try to change it. But besides that, in our case, we were fortunate, because once we got out of the system, of course, we didn't have any money, and then we tried to we built some small enterprises, and we were able to, not easily and not a big amount of it, but we were able to survive financially by our own means. But I'm not trying to, I know that this is very difficult in other countries, in many places this is quite impossible to do. So, but we were able to do it here. So that's the attitude that we've had towards the system. And I mentioned this point because each time I come to this sort of conference, I see that many innovative ideas and new ideas, they clash finally with the system, and sometimes it's difficult to survive outside of the system. And I see lots of efforts to somehow include the new approaches within the system, and many of my colleagues are able to obtain that with lots of efforts. But it's already happening in many places that can happen for a few years, and then it goes back and they are sacked out of the system again, or at least they are not paid anymore. So it's a very difficult piece, a very difficult point. And but of course, what I'm telling you is just let's say, sharing the Colombian experience as far as this is concerned. The other, let me move a bit. The other principle that has guided us is that we think that all these new approaches that we're working on are only possible if we are willing and to take reasonable risks. If we are risk averse, it's kind of impossible. So we have to take risks, but risks in at least in two big senses. Risks in the sense of the people, with the risk that people take when they become part of any innovation, because we all know that those who don't share our views and who try to remain in, let's say, old style approaches and old style ways of thinking of so-called mental illness, they are all their eyes are put on us, and it's I mean, we know. Let's take an example. we know perfectly well that there's a percentage of people, of human beings that unfortunately commit suicide. That's something that happens, and that will continue to happen, and has happened always. But if a suicide happens in a program or within a program that's innovative, that's new, that's trying to build new approaches, that's going to be very difficult to handle, and the way that's going to be judged is much different than if it happens in an old style approach that we all know can even induce suicide in a much more easier way. No, but that's a reality that all of us have been working in this kind of attitude, have to take reasonable risks, and people have to take some risks. I just mentioned the suicide, but that's not the main risks, or at least not the most frequent, fortunately. But there are lots of risks for the people to recover. It's not a people who recover. If you see it, successful cases of recovery are people who have taken reasonable risks. In our approach, we don't think it's part of the leadership of the person. I mean, the risks that the person himself or herself decides to take. No, those risks are the one I'm talking about. And the other area of risks that I would like to mention is the taking risks as a movement. No, not individually, but as a movement. In our case, probably the three bigger risks that we have taken always are financial risks, legal risks, and political risks. And those are things that if you want to succeed in a new approach, you have to be aware that you're facing those risks and preparing for them, and preparing yourself to protect yourself financially, legally, and even politically. Politically, in this moment, I'm not talking about. I'm talking about the politics of our small world of mental health. No, that you'll have interesting and complicated conflict probably with your colleagues and other people. I just want to remind you very quickly of the approach because COVID is new. But accompanied self-rehabilitation is not new. The reason because of which we have observed that COVID has also, besides the pain it has brought, the relief it has brought, is mainly because it complies with one of the main principles of accompanied self-rehabilitation, which is redesigning lifestyle. You see, with COVID, before COVID, let's put it that way, before this pandemic, it was not in the mind of everybody in the world as it is today, the importance of changing lifestyle, changing in all ways you can, in every way you can possibly imagine. Suddenly, this is there, no, and everybody is thinking of new lifestyle. People are moving from living in big cities to the countryside, and others might do it the other way around for some reason. People are changing their jobs, the way they work. Even the people with whom they live is kind of people are having everything is in a question mark on what your lifestyle is, and that's the atmosphere that we were very. It was very hard for us to encourage in our program, to put that atmosphere of changing lifestyle. And now it's over there. So we're beginning to see, we still have to see what the research and the data on that shows, because of course we register all this very carefully, but we're beginning to see in our preliminary information about with regard to the development of the people, we're beginning to see how people are recovering and together with that are being able to look for new ways of life in a much easier way. That's there. There are much socially, the community is not so resistant to change in lifestyle. It's there. It's kind of welcoming. It's kind of I would use the word even, it's the fashion. It's kind of the fashion of the day to change your lifestyle, to modify it. It's accepted, it's tolerable. And most of the examples we had about this, and creativity is allowed, and there's not a moralistic attitude towards how people live and how people decide, at least much less. At least that's what we've seen in our program, which is kind of inserted in our community. Our program is inserted in a community that which is a small town that we have here in, as I mentioned, about 45 minutes from Bogota, the capital, and we work very close to this town, and that's the atmosphere in the town. Not only are the people in our program are struggling to discover which is the lifestyle that suits them, but all the town is in that, and that's the atmosphere. So we've seen that that's a fascinating consequence. I think that I haven't shown to you in detail or explained in more detail our process, how our process has moved. We began, this was in 1982, with what people used to call it a therapeutic community. We didn't call it like that, but we were okay with that. Anyway, what we began in 1982 was the result of, we were all of us who began this program, we were very active during the 70s in all the anti-psychiatric movement worldwide. I mean the 1970s type of anti-psychiatry movement. I'm meaning the experience that we learned a lot from Italy, from Trieste. I remember we had the visit of Franco Basaglia here. I was a student of psychiatry and I met Franco Basaglia. This is kind of 1969 when he visited us here. And we also began to get close to the movement of anti-psychiatry in England with Cooper, Lang. That's where we came from, right? So in 1982, when we began this program, we were in that mood, sort of really finding new ways to understand so-called schizophrenia, so-called psychosis, and certainly finding new, different, and sometimes opposite ways to handle that so-called condition. So in that atmosphere, yes, the therapeutic community movement, and which was earlier than that, was also helpful. But what we really wanted from the beginning was to get rid of the psychiatric institution in those days. But we began like that. We had a facility, which was the facility that I mentioned at the beginning, was considered to be a high-level mental health institution. But we decided to convert it into a shelter for homeless, and that was the only way we could really innovate and continue with our process. So after this therapeutic community, there was a stage in our program, let's call it like that, where we kind of when we kind of moved into the town, right? And that's when we called for many years Sopó, or people called it a therapeutic town. That name was not our name. It was the mayor of Sopó, because one day he visited our facility, right? And he said, oh, I really like the values in your institution, the democratic values, people are compassionate, take care of others, freedom, the values. And so he said, I want those values for my town, And that's when he decided, I want to convert Sopó into therapeutic town. And after that was when we closed our facility and we moved into the town, and everything began to happen within the town. This is about 15 or more years ago, right? But after that, we gradually moved into what we call, refer to call nowadays a social movement. We have a movement, a social movement, more than a therapeutic setting. We prefer, this is a movement. It's a way to understand people, to understand human beings, to understand how we recover, how we change. And this, the big incentive for this was when we began to work in our program together, as soon as some of us became involved in the peace process of Colombia, and many of the ex-FARC members who were fighting in the jungle came reintegrated into society. So we began a fascinating program where we paired, let's call it like that, people from our program with people who were coming from the guerrilla, from the leftist armed groups. And we found that this was a way that a win-win situation, because they were both groups that were reintegrating into society in a different way. People in our program, people who had come from psychiatric settings, reintegrating into the town, and with people who had been fighting for years in the jungle, reintegrating also into society. And it's fascinating to see how the people in our program accompanied people from these groups to reintegrate into society because of their expertise. They had gone through that. They knew how difficult it is to go into so-called normal society after you've been excluded from it for some reason or another. So that was when we began also to understand that this is a social movement more than anything else. And then I think I'm close to running out of time, so I'm going to be a bit quick. But I do want to get this concept to finish with, which is mutual recovery. This was a turning point which we assumed about 8 or 10 years ago. And we understood that although we had got rid of the old style institution, even of the new style institution, we of our therapeutic community, we didn't want that anymore. And we understood that we still, although we were inside the community, and we were still kind of somehow divided into healthy people and ill people, even if we didn't use the word. Even if we wouldn't use the word professionals and clients or whatever, there was a sense that some of us could be kind of healthier than others. So it was our goal to kind of really get rid of that. And the way to get rid of that was to really acknowledge that that's definitely not true, that we, in our program, if we really looked at things carefully, all the interaction was a mutual recovery approach, and that every time we saw that a person we had been accompanied, or even if it's a group or a family that had kind of recovered or moved ahead, that always implied, if we didn't do that, what's impossible, if we change ourselves. That the only way to allow and help people to change is if we are willing to change ourselves. And then we realize it's not only change, we're also recovering. We're also recovering from many things. And so this difference between health and illness really began to really disappear in our program. And this idea of mutual recovery was the password for us to do that. I must confess that one of some of you who have had some psychoanalytic training might remember that one of the first people to use this sort of concept was the mutual analysis of Sandor Ferenczi, the psychoanalyst from Budapest, right? Of course, this is not the same, but it's the same concept, no? It's and I have to acknowledge Ferenczi, because I think he was the first to acknowledge how to really question this idea, that there's someone recovering and the other one is kind of just accompanying that. So we really went into mutual recovery idea, and this was a big turning point for us, I must tell you. And this is something we've been working on. Of course, as all advances have their difficulties, but this mutual recovery approach has been really great. And so and in all the presentations, the discussions, people all people, let's say, who used to be called the professional or the clients, they also talk about themselves and their emotions and what happens to them. And we've been able to really do a shared experience of recovery. Initially, it's interesting because initially it was felt as if, okay, well, this is something that's not exactly like that. We're going to simulate that we're not so healthy or whatever. But when you begin to talk and everybody begin to really express what they say, you can imagine the dynamics. Of course, this is not the place to talk to you about the details of this. And also it's an ongoing process, right? It's something we've been working on now, so we'll see what happens. So you see, this is the idea we have. This is the idea we used. We had realized this phrase was written by us about 30 years ago, no? If we want our patients, we call them patients in those times, to change, first we have to change ourselves. But I bring it here because we said it 30 years ago, but until now we've understood how deep that is, no? That's much easier to say than to do, no? And of course we have to acknowledge Santa Ferencia, as I mentioned, and it is not only changing, it's changing in recovery. And finally, we've been able to kind of integrate the importance of a community, of a group, be it a family or be it whatever it is in recovery. It's impossible to do this thing just individually, but it is also not a good idea to neglect the individual. So we've been trying to kind of reach a kind of a way that the group and the individual are not opposites, but that the individualistic approach and the group approach really complement themselves, and they use each other in some way. No? And so this is basically what I wanted to talk about. I have no time left to talk about what we mean to a company nowadays with all these changes, so I won't talk about that. And I think we have some time for maybe some discussions and questions. If we have them, I'll be happy to do that. So thank you very much.
Thank you so much, Dr. Alberto, for very interesting presentation. And we have few minutes for few questions, so welcome. Would like to discuss or raise the question?
No questions, no comments.
Maybe we'll have discussion at the end.
I understand that two presentations, Alberto, yours, and Anders Lindset, they are somehow interconnected. So
absolutely interconnected. So if you go ahead with Anders, I would suggest respectfully, if you go ahead with Anders, and then we can discuss the two presentations. As we used to say with Anders, it's just one song, right? Okay. And so if people can comment on that, that's great. Yeah.
So let's continue singing, and I have to present our next lecturer.